Hello everyone and welcome back to the channel. My name is Chinako Denibo. I'm a fourth year medical student in the United States and I typically make videos on some common medical problems, and I mostly make them through the form of animation in an easier to understand manner. For those of you that are new to the channel, please do subscribe. Today I'll be doing something a little bit different. I'll be discussing my path from being born and raised in Nigeria to completing nursing school and working as a nurse for about 3 years to finally getting into medical school. So without further ado, let's jump right into it. All right, so I was born in the southeast part of Nigeria. I'm the second of six children, and I lived and grew up in Nigeria. I studied till senior secondary one, SS1, and we moved to Canada when I was around the age of 14. We moved in 2010. So I completed the rest of my high school in Canada. And then when it was time to apply for university, I always knew I wanted to go into something medical related, but I wasn't quite sure exactly what to go into. I initially wanted to go into kinesiology because I was obsessed with sports and I was really good at science. So I thought, might as well combine both. My dad wouldn't have it. My dad, being a typical African man, was very worried about the cost of tuition and the return, practically the return on his investment, with tuition being expensive and the probability of a job prospect upon graduation, especially if medical school didn't work out because of how competitive medical school was. So, funny enough, actually, around that same time, I was debating what to go into for undergrad. My sister had a spine surgery. She had really bad scoliosis and had to be treated at one of the top hospitals in Canada. It's called Sick Kids Hospital. And I'd always go visit her, and she'd always mention to me just practically how incredible the nurses were and how they made her entire hospital stay manageable. So that was when it started to click to me that I could make a difference working as a nurse and still be in the healthcare setting and system, especially if medical school didn't work out. So I then called my dad back, and after going back and forth, I told him I was going to do nursing. And that was how my nursing journey started. So I applied, was fortunate enough to get into a nursing program in Nova Scotia. Shout out St. Francis Xavier for giving your boy a chance. Completed my 4 years of BSN in nursing with first class, and then decided to actually take a year off after nursing school. To my family lived in Italy, in Rome at that time, to travel Italy, travel Europe, and at the same time work on getting my visa to move to the US. No one was left in Canada for me at that time, but I had a lot of family in the US and I wanted to try something new and experience something new. So I just thought US made sense. And I worked on my visa after months of waiting for the visa requirements and going through the entire process. Finally got that done, got all my papers, got all the documentations and visas, and then applied for jobs. Fortunately, I got a job on a cardiovascular step down unit in Grand Rapids, Michigan, and I had an uncle that lived in Grand Rapids at that time. So it made the transition easier because I stayed with them for a couple months till I could find my own feet. But yeah, I worked on a cardiovascular step down unit for just under 3 years. And it was during that time that my desire to go to medical school was practically reaffirmed. I remember the first time I encountered a patient of mine who had a cardiac arrest. I was with this lady who was just admitted from the emergency room. She came up to the unit and she was going to be my patient. I was taking care of her, and she came in complaining of chest pain. So she was eventually going to go to the cath lab, the catheterization lab, the next day for assessment. They were going to look at her coronary arteries, to see if there were any occlusions and if any intervention was needed. And so we were just supposed to observe her overnight, till the next morning. She was an urgent case, but not emergent. So as I was admitting her, we were chatting. All of a sudden, she looks at me. She's like, "I don't feel good, Charles. Like, there's just something off." I looked at her vital signs. Her blood pressure was tanking, and right in front of me, she just passed out. Right away, I pushed the code blue button, and all my ACLS training was practically a blur. Was the first time I was seeing a patient arrest right in front of me, and because it was my own patient, it became surreal. And thankfully, the internal medicine physician was close by. So I remember her coming in and right away just being like, "Charles, we need to start CPR right away." And the entire Code Blue team rushed in, and just watching her run the code and how she just organized everyone, told everyone where to be, told everyone what task to do, when to do what task, when to do the next evaluation, when to continue CPR, when to stop CPR. It was practically watching chaos and poetry. It was like a beautiful chaos. She organized the code in such a beautiful way, and we ended up reviving the patient. The patient made it, and I remember going to say hello to the patient the next day, and the patient was so grateful for everything I did. But like, I knew it was a whole team effort, and I left that day thinking to myself, "Wow, I want to be like this physician. Like, she's just incredible. I want to be as confident in my abilities and skills as she is." So a couple weeks after that, I signed up for some prereq classes at a local university in Grand Rapids, and I signed up to be a part-time student while I was still working. So I always work night shifts. So I'd work from 7 p.m. to 7 a.m., practically 7:30 a.m., and then would have classes starting around like 9 or 10 a.m., and classes would go till 12 noon, sometimes 1 p.m., and then I'd sleep and come back to work at 7 p.m. So I did that for 2 years, got all my prereqs done, took the MCAT, and I remember thinking to myself when I was taking the MCAT, or rather when I was studying and preparing for the MCAT, there's no way I can take this exam. There's just no way. Like, this is not possible. I kept failing all the practice exams, and I called my mom crying a bunch of times, like, "Mom, this is not possible. I can't do this." My mom kept encouraging me, like, "You can do it. Keep going." And at the same time, I also applied to master's program, master's in nurse practitioner, master's in nursing, to be a nurse practitioner. And I got accepted to a program in Michigan, and I was going to accept it. But the final day of acceptance, my sister called me and was asking me how things were going. And I told her about the program. And she told me, "Ever since I've known you, you've always talked about wanting to be a physician. Why don't you just at least try? Like, you don't want to ever grow up with having the regret of not trying." So I really took that to heart. And I told myself I had to try. I had to at least give it a try. So I decided, all right, okay, I have to buckle up and figure out a way around this MCAT. And then I found a Princeton review course that I practically invested in. I paid a crazy amount of money for this Princeton review course. I think it was a month-long course. We had classes every day on every topic, and then they also provided you with test-taking strategies and also some sample exam. So that 1 month of taking classes every day kept me so accountable, and it helped break down just how to approach the exam and how to approach the test. And it made a huge difference in terms of my scores and also my confidence in approaching the exam. I always knew I was gonna like be in the 99th percentile of the MCAT or anything close by. I actually ended up being in the 52nd percentile, I think it was. I scored a 502. So not great, but it was barely enough. It was just what I needed to get across the median and make applications possible so that when they screened everyone, I wouldn't be automatically shut out. Because I knew my experience was probably going to be my biggest strength. So I just had to work hard enough get into to get into the door, to just not be just not have the door closed on me before I even had a chance. That was my overall goal. Just to get my foot into the door, and then I knew my experience and my passion and my desire to be a great physician um, would would show itself. But anyways, fortunately, working as a nurse at the hospital I worked at, there was also some affiliation with Michigan State University, and I made a lot of great connections during that time. One of my letter writers was an interventional an interventional vascular surgeon, and he wrote me a letter of recommendation. I shadowed him in the operating room. He had known me the whole time as a nurse because I always took care of a lot of his patients. So those kind of connections really helped a lot, and that helped get my foot into the door and give me a chance. And thankfully, Michigan State invited me for an interview, and they gave me a chance to be where I am today, and I'm extremely grateful. So yeah, so that was my path. And I remember while I was also applying to medical, after I've taken the MCAT and got my score back, and it was a 502, I initially was devastated. I told my dad, look, dad, like this score isn't great. I'm most likely going to have to apply again in the next cycle. I'm going to have to retake this exam again. And my dad told me, that's okay, but still just send in applications. And my initial plan was to send in into maybe two or three programs. I truly had like zero confidence in that I was going to get in anywhere. But while I was at work one day, I overheard an older nurse telling a fellow nurse that she heard that I was studying for the MCAT. And she was like, Charles, MCAT, that kid's barely good enough to be a nurse. There's no, he has no chance of making it into medical school, more or less being a physician. Michigan State has this flipped classroom style where you learn the material on your own, and then you meet in small groups and you discuss the material. So there's no one there actively teaching you. You do the learning yourself, and then you come and discuss it as a group. And there's always a professor who's most likely a physician, as well as an assistant professor during those small group sessions, and they run the session, and they also do some teaching when needed. And you're with the same small group throughout your first 2 years of med school, so you become like a family. And those guys were the people that carried me through whenever I was struggling. And then my third and fourth year, that was when my nursing background shone. Just that experience, the comfort of knowing just how to be bedside with a patient, the comfort of being in the moment with patients, just being present whenever you're with patients and their family members and their loved ones. That was when my nursing background had the most advantage and shone the most for me. So yeah, that was practically the path. And now I'm in my fourth year. We find out where we'll be going for residency next week. It's coming up soon. I'll try to make a video covering my match week. But in terms of my path to medical school, would I do it all over again? Yes. Yes, I would do it the exact same way all over again. I have no regrets on the way everything went. Being born and raised in Nigeria gave me some solid backgrounds that I wouldn't trade for anything else. It taught me the importance of community, importance of hard work. I remember primary school, I had to walk to school every day, and we had our notes were written on chalkboard, even in secondary school. So you always had to get the notes. There was no internet, so there was no way for you to look up your assignment questions. You had to do everything by yourself. It just taught me the importance of like hard work, and also building a community and utilizing your friends. I'd exchange notes with classmates who had better notes than I did. I'd study with friends. And then also doing nursing as the first degree was so valuable. It made me mature as a human being. It made me view medicine in a whole different lens. Before nursing, I always kind of glamorized medicine. I viewed medicine as the physician comes in, the patient is sick, and the physician does some CPR and saves the patient's life, kind of like what you see on TV. But nursing taught me that sometimes the most important part of medicine is just being present with the patient, listening to what they're going through in that exact moment, being there with them, knowing that they trust you so much to share such vulnerable things that sometimes they wouldn't even be comfortable sharing with their family members, but they trust you so much to share that with them, and also for them to share that with you. And that to me is a huge privilege and something that I don't take lightly. So some of the great benefits that I think nursing had and gave me were, well, too many to remember, but just going off the top of my head, some that I can think of, where first of all, like I mentioned, the comfort at being bedside with patients, just knowing how to be present with patients, knowing how to deliver a message, be it good or bad, or anything in between, to patients and their family members, knowing how to read a room, some sixth sense that they don't teach you in school, that you just needed work experience to get. Another great benefit that it had was the interprofessional aspect of it. As a nurse, you're almost like the quarterback of the patient. You're always advocating for the patient because that's your sole goal, to make sure that your patient is well cared for. So, being able to adequately advocate for my patients, and working with the rest of the healthcare team in a professional way was a skill that I built over those 3 years. Working with the pharmacy, the medicine team, the consultants, PT, OT, and letting one part of the team know what the other part is thinking and delivering all that message back to the patient, because you're their first point of contact, or the patient's first point of contact. You're the first person they usually call out to with any questions. Another benefit was also the procedural aspect. As a cardiovascular nurse, I got involved in some procedures, be it just simple things like IV insertion, as well as taking out the catheter that they used for, like they use in the cath lab, whenever they took a patient in, for cardiac assessment, or to put a stent in. And then another skill was just also having that sixth sense of when something looks like it's going wrong. The work experience as a nurse, because you're always by the patient, you end up developing this sixth sense of something is off. I can't really place a finger on it, but I feel like something is off. And that's another skill that I feel like just couldn't be taught in class. And it was something that I also took with me, especially during my third and fourth year of med school, my clinical years. And then also the humility that you get from being a bedside nurse. You're with the patient at their most vulnerable times, especially when you have to help them with a lot of the activities of daily living. You have to toilet them, you have to clean them, change their beds. If they soiled their beds, you help them with that. So that really does humble you and shows you just how important every member of the team is, and just how important everyone's task is. So those were some of the benefits that come to mind right away. But I'm sure there are a lot more that I just can't think of right now. Would I do it all over again and go through nursing again? Yes, I would. And I don't regret it at all, one bit. And am I also glad that I proved some people wrong? Some people who thought that I'd never make it to medical school. Yes, I'm glad, but I'm most glad that I proved myself right. And I'm most glad that I wasn't afraid to take that leap of faith and try. I had a lot of self doubts along the process. I doubted myself so many times. I questioned whether I could make it, and if it wasn't for the confidence that my mom, my sisters, my dad, my brothers, if it wasn't for the confidence that they had in me, I most likely wouldn't have applied to medical school. So, practically in summary, sometimes you just got to take that leap of faith. You never know what the limit is and what your ceiling is. You just have to keep pushing the boundary. And also, it's okay to be afraid. It's okay to be scared. It's okay to have self-doubt. It's very important to surround yourself with people that are very positive, people that are that will always have your back. And in my Igbo language, there's something that they say, and that's onye nwe mmadụ nwere ego, and that means someone who has people is wealthy. So that's practically saying that connections is everything. Connections and mentorship. I'm in the position I am today because of the mentors I had. I'm in the position I am today because of the great letters of recommendations that I had. Like I mentioned earlier, the vascular surgeon that wrote me a letter of recommendation. I truly believe people that wrote me that letters of recommendation, people that wrote me those, people that let me shadow them, people that were mentors to me, are all the many reasons why I'm where I am today. And that's something else that I'm also trying to pass along, and also trying to give to the next generation and those trying to go through a similar path. But yeah, so that's my journey. Feel free to leave any comments or any questions in the comment section, and please do leave a like and subscribe. I'd really appreciate it if you could, and it'll really mean a lot. Hope you have a great day. Thanks you all for watching. Catch you in the next one. Bye.